Hi everyone, today I shall discuss about the scapula, which in English it is known as that is the shoulder blade, and it forms the shoulder girdle, and this scapula, for easy remembrance, it follows the rule of 3. You see, it has got a glenoid or the head, it has got a constricted neck, and it has got a body, triangular body of the scapula. It presents 3 angles. What are the angles? This is the superior angle of the scapula. You see, it corresponds to the second rib that helps in the surface marking, and it helps in the clinics. And this is the inferior angle of the scapula. It corresponds with the 7th rib. And this is the lateral angle or the glenoid, which is directed forwards, laterally and slightly upwards in anatomical position. It has got 3 borders. You see, this is the smallest border, which is known as the superior border. This superior border starts from the superior angle, then there is a notch on the medial aspect, and that notch ends in a process that is known as the coracoid process. So this notch, it transmits suprascapular vessels and nerve, which supplies this muscle present here. So this is the superior border. Next, the medial border, which is the longest and the thinnest border. You see, it extends from the superior angle up to the inferior angle. This border has got a ventral surface and it has got a dorsal surface. Now I will tell the attachment later on. Next I shall discuss the thickest border of the scapula, that is the lateral border. You see how thick it is. Now this lateral border extends from the infraglenoid tubercle up to the inferior angle of the scapula. Similarly, it has got a ventral area and it has got a dorsal area. So these are the 3 borders. Now there are 3 processes. What are the processes? You see, there is a beak-like process, that is the crow's beak, that is known as the coracoid process. In the coracoid process, you will see it looks like coracos means crow. So it is crow's beak like. It is the example of atavistic epiphysis. That means the phylogenetically it is a separate piece of bone. That means in case of chicken we will get this bone is separate. But in human being it comes here to get nutrition from the other bone. Next you will see there the spinous process. In the dorsal aspect, you see one can feel the spine here. Everybody, in the fatty person also, everyone feel the spine. You will examine your spine, you can feel it. You will see this spine, it goes backwards and form a thick crest, and this is known as the crest of the spine. And you will see in front of the crest, there is a fossa, which is known as, fossa means depressed area. This is known as the supraspinous fossa. And here you will see the large 2/3 is the infraspinous fossa. Now this fossa lodges the muscle. You will see here the muscle here, this is the supraspinatus muscle. It goes from here and ultimately it is attached here to the fossa present in this region. So supraspinatus that initiates the abduction movement. You see, this 15 degrees of abduction, this is initiated by this muscle. Now, the lower fossa, it gives attachment to a very big muscle which is known as the infraspinatus, and all these supraspinatus, infraspinatus and a muscle arises from here. Now you will see the spinous process, it actually ends into another process. The process on the lateral aspect, it is vertically placed, and this is known as the acromion process. This acromion process has got the dorsal surface, a ventral surface, a medial border and the lateral border. Junction of the acromion process with the lower end of the spine is known as the acromial angle, which one can palpate it, that means feel by their own hand. And this acromion process, on the medial aspect there is a oval facet, and this facet articulates in front with the clavicle, forming the acromioclavicular joint. Next thing is that this spinous process in the dorsal surface, you will see that it gives insertion to a muscle, and the name of the muscle is the trapezius. So it is the trapezius is attached here. You see, everyone can see the trapezius. You will see from behind, you will see this is the trapezius muscle, this muscle. You see the trapezius. In cervical spondylosis, this trapezius becomes stiff, and don't rub during spondylosis because there is further stiffness of this muscle. So you will see this is the attachment of the muscle which is known as the trapezius. Now in the ventral aspect, there is, that means the lower border, it gives attachment to another muscle, that is the big muscle which is known as the deltoid. Why it is called deltoid? Because it is delta shaped muscle. One can feel the muscle. You see, when you abduct your arm, that is, you take laterally your arm, your deltoid, the triangular deltoid becomes prominent, and one should give here the intermuscular injection. So always remember this deltoid attached in the lower part of the crest of the spine. Next thing you should know, so this is the three processes. Next is the muscle in front of the ventral surface of the scapula. This is the dorsal surface which you will see. Here there is the attachment of the supraspinatus, the infraspinatus muscle, and here the ventral surface, it is concave, and here there is some ridges because this muscle is very strong and it is attached in this ridge. So this is known as the subscapularis muscle. Now this is the subscapularis muscle. You see, during dissection it is so bulky muscle. So all these muscle, supraspinatus, infraspinatus, teres minor and subscapularis, is protect the shoulder joint, and it rise around the shoulder joint. So these form the rotator cuff muscle. You see, all the muscles are situated here, and this is the rotator cuff muscle, that is the stabilizing factor of the shoulder joint. That is, it prevents from frozen shoulder by stabilizing this muscle. Next thing, you will see what are the attachment takes place. This is the coracoid process, the tip of the coracoid process, this is the tip of the coracoid process gives attachment to so many of muscle, though it is attached with the so many of muscle, but it gives you can feel it by deep palpation. What are the muscle attached here? They are the short head of the biceps, the coracobrachialis, and these muscles attached in this and pectoralis minor. So these three small muscles are attached here. So again there is rule of three. So next is that I shall discuss about the superior border. Now the superior border, it cannot be palpated, but in the suprascapular notch below, there is a very small muscle that is known as the inferior belly of the omohyoid. This muscle goes ultimately to the triangles of the neck region. So you will see here. Now medial border. Now the medial border, it is thin, but it is the longest border. In the ventral aspect, it gives insertion to a muscle which is known as the serratus anterior. The 3-digitation of the serratus anterior muscle, that means it includes the inferior angle also. So the whole length, this is the serratus anterior. Why there is the serratus anterior? Because you know, when you push, so you see that this is the serratus anterior muscle attached here. There is the 8-digitation of the serratus anterior. You will see in the labor class of people who is muscular, when they push anything, there are digitation of the serratus anterior appear. Next you will see on the dorsal aspect. Dorsal aspect in the upper part from the superior angle up to this triangular area, it gives attachment to a muscle which is known as levator scapulae. That means it elevates the scapula. Elevation of the scapula is required, and you will see this area, that medial triangular area, gives attachment to the rhomboid's minor muscle. Rhomboid means rhomboid shaped muscle, and below the area gives attachment to the rhomboideus major. Now this muscle, it actually, what will happen? The protraction and the retraction of the scapula, it is done by this. So this is the about the scapula. Now how we will hold the bone in anatomical position and determine the side of the bone. You will hold the bone in such a way that the dorsal aspect will be identified by the spine. The ventral aspect, you will see there is the concavity. I remove this thing, the plasticine, then you will see this part is concave. So the concavity on the ventral aspect, you see here also the concavity. And the glenoid is on the lateral aspect, and you should hold the scapula in the inferior angle. Why in the inferior angle, not in this way? Because you should show the person in such a way that the whole of the scapula is visible. That's why you should hold it in the inferior angle. And you will see this coracoid process should be directed forwards and just laterally. And this is the anatomical position of the scapula. So thank you everyone.